Is there anyone here today who has not been affected by cancer? A close relative, a friend, or yourself? We've all been affected. If you haven't been, then it's coming. Chances are we've all been affected. This talk may very well just change the way you approach it. I'm here to open your mind to an extra option in management, a choice to starve cancer. Now, we're told that cancer is a chromosomal abnormality. It's damage to our genetic material. And that's what we've been taught. But what happens if the chromosomal damage we actually see is just a marker of cancer and not actually the cause? It's a slightly controversial topic. But the most dangerous phrase we keep hearing is, we've always done it this way. So what if the chromosomal model of cancer is actually wrong? So I want you to consider now that the primary problem, cancer, may have little to do with the chromosome, and it's probably all tied up with glucose metabolism within our mitochondria, the engines of our cells. But the chromosomal changes are what we see and have been blamed as the cause, but in fact are just the effect. So have we been travelling the wrong road for the last 90 years? I'll come to that 90-year figure in a moment. And if so, this opens up a whole new range of management in cancer. So I'm going to blame the microscope. I think it's distracted us. I call it my Ansel keys of the cancer world. So the microscope gave us cholesterol to blame. They saw cholesterol plaques in cardiovascular disease, and we then blamed cholesterol on cardiovascular disease only for about 80 years. We now know that cholesterol is just a marker of cardiovascular disease, and actually a pretty poor one. So the microscope, in the same time frame, at the beginning of the last century, gave us the chromosome to blame for cancer. You'd look down the microscope and you'd see all these deranged chromosomes. Oh, that's got to be the cause of cancer. But again, what happens if it's just the marker and not the cause? I think that both cholesterol and chromosomes are victims of circumstance. They're both at the scene of the crime, but they're actually not to blame. So it's a bit like going to a fire and seeing lots of firemen there. They're actually there just at the scene, but they're not the cause. And certainly getting rid of cholesterol hasn't solved cardiovascular disease, and we're seeing with statins now a whole lot of side effects developing. And so by the same token, attacking chromosomes by destroying them with radiotherapy and chemotherapy doesn't actually solve cancer. It may treat it, but it doesn't actually address the cause. So this is a PET scan of a person riddled with cancer. Some of you may have heard about PET scans. Multiple hotspots means multiple secondaries, multiple metastases. That's what kills you in cancer. The primary cancer doesn't get you, it's the secondaries. PET scans are a measure of glucose metabolism, and virtually all cancers are positive on PET scans. And the more aggressive it is, the more positive it is. So what are the chances of multiple chromosomal abnormalities against all the variety of cancers, all ending up with the one metabolic pathway, all based around glucose? Compare that to one deranged glucose metabolic pathway that fires off masses of oxygen-free radicals and then causing multiple chromosomal abnormalities. What are the chances? Now, Otto Warburg in 1924 tried to tell us this. He's a legend, just like John Yudkin is to the whole sugar story. And he had the luxury of research that was unhindered by funding meetings and ethics committees. He was a contemporary of Einstein, and they just got together, all these people, did their research. He won the Nobel Prize in 1931 and was nominated for 3 times for that award. So Warburg described the diversion of glucose away from energy production to cell growth. And he showed that the problem was actually in the mitochondria, the engine of the cell, where fuel is turned into ATP, adenosine triphosphate, and Warburg knew that there was a defect in mitochondrial metabolism. And he actually went to his deathbed in 1970 after addressing Nobel laureates a couple of years before, pleading with them that maybe the cancer model was wrong. Unfortunately for him, he did not have the luxury of the internet and social media to spread the message. And maybe some of us are trying to take up that mantle for him now. So I think most of the medical profession have ignored the common metabolism of cancer. So if we can consider cancer from a metabolic model, then we have the potential to starve cancer. And nutritional ketosis may be an option. Nutritional ketosis is a lifestyle of reduced sugar and carbohydrate. It is about not having an elevated blood glucose, and it's certainly about not having an insulin spike and an insulin growth factor 1 spike. And I'll keep coming back to those. When you eat carbohydrate and too much protein, you actually spike your insulin and your insulin growth factor 1. I think nutritional ketosis is bad for cancer, and it's particularly protective of the cells around the cancer. As I said, I think most cancer goes wrong the same way. And the problem is based around energy and ATP production, away from that energy pathway, with then oxygen-free radicals being released, secondary chromosomal damage, and now I'm going to try and explain how that occurs. This is the metabolic model of cancer. Cancer growth requires building blocks, raw materials, and they're either going to be sourced locally or they're transported in. That's what cells require. They need material to grow. Glucose is the primary fuel for that growth, and it's transported in massive amounts. That's the Warburg effect. That's the PET scan. The other building materials are protein, fatty acids, phosphate, and acetate. And cancer steals those building materials from its surroundings. And that's called the reverse Warburg effect. That took me about 6 months to get my head around that, the Warburg effect and the reverse Warburg effect. And they were described 70 years apart. But I'll try and simplify it down. So that invasion of surrounding cells for those raw materials accounts for how cancer spreads, how cancer metastasizes, and how cancer eventually kills us. And the driving force behind all of that growth, again, is those damn oxygen-free radicals. Those oxygen-free radicals then zip out, cause random DNA damage, and that's the cause, I believe, of our chromosomal abnormalities. And again, now we've got the chromosomal damage is the marker of, not the cause. So now if we can go back and say, what's the source of those oxygen-free radicals? And again, we come back to inflammation. Inflammation drives oxygen-free radical production. And if we can go back one more step and say, okay, what unlocks inflammation? We can unlock maybe the key for cancer, not only in the treatment, but also the cause. I think the modern diet is inflammatory. I think the combination of sugar, and particularly fructose, refined carbohydrates and polyunsaturated oils is an inflammatory, toxic reaction that's going on in our body. It produces a massive oxygen-free radicals, and that is toxic. And that combination may in fact be the cause of cancer. And now if we consider this model, then we have new cancer treatment options. So therefore we now direct our treatment at the cause of that damage and not at the chromosomal replication. And I actually think this makes more sense. I actually think Mother Nature is beautifully simple when the pieces come together. And if you haven't seen the simplicity in Mother Nature, and it's a whole topic I talk about, the simplicity of it just makes sense. And if you haven't worked it out, if you haven't worked out the simplicity of it, you haven't worked it out. Because Mother Nature's pretty simple. So what doesn't make sense to me is the chromosomal model. We know that the damage DNA in that cancer. And we know that oxygen-free radicals are involved, but no one's talking about where the oxygen-free radicals come from. And again, why is our treatment of chemotherapy and radiotherapy aimed at destroying the damaged material? I mean, I'm always been one to go back one step. Why? I'm just a pain in the arse kid. What are the flaws in the current chromosomal model? Okay, first of all, most cancer rates are increasing across the board, particularly in the developing world that's introduced modern food. Many cancers have multiple chromosomal abnormalities. Now, it's not one. They can have 5, 10, they can have 20 or 30 different chromosomal abnormalities within the one cancer. 5% of cancers have no chromosomal abnormalities. When you look down the microscope, there's no genetic abnormality. And it's put down to the fact that, or maybe they couldn't find it in the specimen. Only 10% of cancers are genetic, are familial. We're told it all runs in families. I think food runs in families more commonly than actually genetics run. Most cancers are in fact random presentations. And the mapping out of the genome over the last 20 years has not given us the answer to cancer. We were told, those of us in medicine 20 years ago, we're going to map the gene. It's going to give us the answer. Well, it hasn't. And current radiotherapy and chemotherapy treatments are actually quite harsh on us. So Thomas Seaford is from Boston, and he's done some seminal work on this. And it's a really simple experiment. He got some normal cells and he got them to duplicate, and he got more normal cells, so that makes sense. He then got some cancer cells to duplicate, and he got more cancer cells. Well, there's nothing surprising in that. He then got the nuclei of cancer cells and put them into normal cells. And if cancer's a genetic model, chromosome model, he's taken the genetic material from the nucleus, he's put it into a cancer cell, and he got normal cells. He got no cancer. He then did something a bit different. He then got normal nuclei from cells and then put it into cancer cells, what we call the cytoplasm, put it into the cells. And in the simplest possible way, that produced cancer cells. And in the simplest experiment, that pushes us away from the chromosomal abnormality. The primary problem here appears to actually be in the cell, in the cytoplasm, rather than actually in the nucleus. So this proposes an alternate model of cancer that based around growth pathways and metabolism. So I'm going to go through that alternate model. What are our observations? Well, we're getting fatter and sicker than ever. Our rates of cancer are increasing. 1 in 2 males are going to have cancer. 1 in 3 women. There's been projected 70% increase in the amount of cancers in the developing world over the next 20 years. Children's cancer is increasing 3% per annum. 3%, year in, year out. The introduction of a modern diet, Western food, into native populations has been associated with the introduction of Western cancers. That's in the Inuit Eskimos. In New Guinea, cancers were not noted before the introduction of KFC. I'm not blaming KFC, but the timing of Western food came in then. The same thing goes in the Polynesian islands. I go to Vanuatu and do some foreign aid work each year. They did not see Western cancers until the last few years. And they've had Western modern food for about the last 15 years. There's clearly an increased incidence of cancer in those patients who are obese with a poorer prognosis. And if you're diabetic, you've got a higher rate of cancer with a poorer prognosis. And there's a pattern here. What about a mechanism? So I'm going to simplify some biochemistry, and that's what I like to try and do in this whole topic. So what the common features of all cells is that they need fuel. And those mitochondria within the cells are the engines where that fuel is actually turned into energy, into ATP. And ATP is across virtually every living organism on the planet. It is the basic molecule. And our mitochondria don't mind where that ATP fuel comes from. It doesn't mind if it comes from glucose or it comes from ketone bodies from fat. Now, those cells also convert fuels into building blocks for making more cells. So in a normal cell, fuel, whether or not it's glucose, ketone bodies, is mostly turned efficiently into energy, into ATP, and a little bit into building and maintenance. But in cancer cells, it's the opposite. Small amount of fuel is turned into ATP, with the majority of that fuel diverted into building materials. And cancer focuses on growth rather than energy. And it's a diversion of glucose away from ATP production back into growth. The exception is that a cancer cell can't metabolize ketone bodies, which are sourced from fat. They are very dependent on glucose, and that glucose comes to us from sugar and carbohydrate. And that's the Warburg effect, that what we now call the fermentation of glucose by aerobic glycolysis for the biochemists here. So a little bit of biochemistry. A normal cell converts glucose to pyruvate. The pyruvate enters the purple mitochondrion there, the engine of the cell, and it produces about 36 ATP. That whole process is under the influence of insulin and insulin growth factor 1, which again is directly related to how much carbohydrate we intake, and to a lesser degree the protein. Where in a cancer cell, it metabolises it differently. And here's the Warburg effect. Only 5% of pyruvate enters the mitochondria. You get about 4 ATP, 1/9 of what you get with a normal cell. And the rest of it is diverted into making building blocks for cells. And again, it's under the influence of insulin, insulin growth factor 1. And that lactate is then diverted into phospholipid, which is made up, then utilised for the production of cell membranes, mitochondrial membranes, and the DNA backbone, the ribose 5-phosphate backbone that's in DNA. Cancer cells need glucose. They cannot use ketones as a fuel source. However, the surrounding non-cancerous cells can. So that the surrounding cells can use ketones. So I think this has a protective potential effect on surrounding cells. And this creates options. You've got cancer. Let's create some options. Okay, we could decrease the amount of glucose available. By decreasing the availability of glucose, by decreasing the amount of sugar and carbohydrate we have, it definitely decreases the amount of circulating insulin and insulin growth factor 1, and that's less promotion of growth. So what else does a cancer cell require to grow? Well, I talked about it before, it certainly needs fuel in the form of glucose, but those cells also require building materials, and that comes from protein, fatty acids, phosphate and acetate. And these are not readily available in the circulation, but they are there right next door. They need to be stolen. Stolen by this bandit called a cancer cell. That's called the reverse Warburg effect. It's the local tissue invasion that allows the cancer cells to steal those building materials. How does a cancer cell steal those? It's the same aerobic glycolysis as the Warburg effect, and it's entirely glucose dependent. Oxygen-free radicals are released. That creates hydrogen peroxide. A lot of you know what hydrogen peroxide does. It's a bleaching agent. It changes our hair colour. Not mine. Oxygen-free radicals then interact with the water in the tissue. You get the hydrogen peroxide. It causes cellular damage, particularly on the fibroblasts that are around. That releases material. That's local tissue invasion. It's all implicated in the process of metastasis. So therefore, those building materials are released by the cancer cells having the effect on the surround. That Warburg effect also gives cancer cells the ability to actually invade. So the reverse Warburg effect gives us the rest of the building materials by destroying the cells around it. And hydrogen peroxide is the way cancer does the local damage. They're there again. So I keep coming back to oxygen-free radicals. They are the trigger. They create havoc and disrupt pathways. How they do it and where they do it is still being worked out. I don't have that answer, but they do it. Now, if we can work out where they come from, maybe we can stop their generation. Inflammation drives oxygen-free radical production. So again, let's re-look at my nutritional model of inflammation. The modern diet is inflammatory, produces a mass of oxygen-free radicals. Where does that happen? Here's my theory. Sugar, particularly fructose, refined carbohydrates and polyunsaturated oils. And it's a complex message because I'm not saying just sugar and I'm not saying just carbs or just wheat. I'm talking about putting three things together. If we increase our sugar intake, particularly fructose, we get an increase in those small dense LDL particles. They end up in every blood vessel wall. And via the polyol pathway, if we increase our carbohydrate intake, we convert that into fructose and then increase those small dense LDLs again. We're starting to flood the system. We then make a decision with the polyunsaturated seed oils that we take in to fill up those LDLs with polyunsaturated oils. They become inflamed and oxidised. And we do the same thing with the cell membranes, and we do the same thing with our mitochondrial membranes. That equals inflammation in every blood vessel, in every cell, in every organ of the body. Oxygen-free radicals are released at every single step of that pathway. And that inflammation, I think, is implicated in modern cancer. But the exciting thing is that creates multiple points of intervention all along the way. Multiple sites wherever this process is occurring. So to me, I could cut out the sugar, I could cut out the carbohydrate, or at least reduce them significantly. I can certainly, in my mind, cut out most polyunsaturated oils. I could use antioxidants at multiple sites, or we could just do the lot by cutting out processed food. Have I got any association evidence for all of this? Well, let's look at diet, let's look at some drugs, some epidemiological data, and I'll be brave. We might even look at the biochemistry of religion and how that might just link in with cancer. Dietary. What has the food industry given us in the last 50 years? Well, what have we as consumers demanded of the food industry? And it's convenient processed food. Convenient processed food. That's what we want. We want it cheap, we want long shelf life, we want it to taste good, we want to be able to snack on it at midnight. So I think we're just as much to blame as the food industry for requesting processed food. In the 1970s, we increased our sugar consumption. We did the same thing with our carbohydrate consumption, with this rapid increase in the amount of polyunsaturated oil consumption, all with a corresponding increase in cancer. Again, this is association evidence. It's not causation, but it fits. Do we have any drug association evidence for the metabolic model? Well, I think we do. Aspirin. 43 randomised controlled trials show an overall reduction in cancer rates. What is aspirin? It's an anti-inflammatory. It's low grade, it's not particularly powerful, but long-term, small amounts of aspirin seem to have a reduction in cancer rates. Metformin. It's a drug commonly used in diabetes. It reduces the tissue levels of glucose, and it's been associated with overall reduced rates of cancer. And this is probably where part of my journey started when I was introduced to this topic out of a Colombian paper out of South America, looking at, hang on, patients with diabetes who were on metformin had a better prognosis than those that weren't. And if you do have diabetes and you get onto metformin, your rates of cancer reduce to non-diabetic rates. And certainly there's been some showing that there's a slower progression of metastatic disease. Antioxidants. Multiple papers of varying quality showing benefits of antioxidants in eating fresh food. So antioxidants can work at multiple sites wherever oxidation is occurring. Where they work is actually academic. Vitamins. Vitamins are all involved in modifying inflammation and oxidation. Again, multiple papers of varying quality, and it's hard to draw to any definitive conclusions. But I'm wondering whether or not it's not the vitamins that's the problem, it's actually, let's talk back on that inflammation. So based on history, certain cultures had no or very little cancer until the introduction of modern food. And again, we talk about the Eskimos and New Guinea neighbours to the north and in Polynesian islands. And there are some communities around the world, the longevity cultures, that live to a very, very old age with low cancer rates. And guess what? They're generally free of processed food. But where does religion fit into it? What have all religions got in common? What do they all practice for health and spiritual well-being? And I propose that that state of well-being is achieved by fasting. And fasting is a state of nutritional ketosis. Christianity has Lent. Islam has Ramadan. Buddhists intermittently fast every day. And it's observed by all religions in some form or another. Religion has recognised the benefits of nutritional ketosis, of fasting, for thousands of years. Now I'm just stating why I think religion has observed that. And fasting, I believe, is nutritional ketosis. We have an increased meal frequency over the last 30 years. Most people are now having 5 to 6 fuel stops per day. Fasting and nutritional ketosis cannot happen with all the eating and snacking we do. I don't believe in our modern society there's ever actually an opportunity to drift into ketosis. And again, here's some more association evidence. As church attendance decreases, and with it the practice of fasting, cancer rates have increased. Again, not an association, just an association and not causation. So, do we have any intervention evidence for this? Well, let's go to the laboratory. 63 animal studies that I'm aware of have looked at caloric and carbohydrate restriction and cancer growth. They're effective, and ketogenic diets are more effective than just caloric restriction. This is a forest plot. Everything to the left suggests it's a generalised benefit in animal studies of low carbohydrate diets in cancer growth. Human studies are small, virtually all done on end-stage cancer patients in a last-ditch effort, but they have been shown to be safe. And in those patients who've actually stuck with it, it's tended to show a stabilisation of disease. Not a cure, a couple of cures, but a stabilisation. There are at least 15 registered trials in the world at this point in time looking at this very topic, ketogenic diets and cancer. Quite a few on brain cancers, some on breast, pancreas, none in Australia. It's also anecdotally being practiced by a lot of people. It's done by many patients on an ad hoc basis, and clearly the whole topic needs some more research. Now, this is an interesting study on mice that can't be done on humans. Mice were given a lethal dose of chemotherapy. 2 groups, one that were in ketosis, and the other ones were on a standard diet. And the ones in ketosis had a 96% survivorship in comparison with only 34% that weren't in ketosis. Nutritional ketosis at an experimental level appears to be protective, at least in mice. And therefore that raises the issue, maybe chemotherapy and radiotherapy are better to be had in the morning when you're a bit fasted. This work by Colin Champ, they showed that radiotherapy has improved outcomes by decreasing carbohydrate intake, a mild reduction in protein, and an increase in fat consumption. In my research of this, I looked up miracle cures. I didn't read all of these books from cover to cover. I've got a few more. But the common theme in miracle cure books is that they avoid sugar. They also talk about the power of hope and taking back some control. And you've heard those words expressed earlier today about taking back some control and having some hope. And if you have cancer, or if you've got a serious illness, you in fact lurch from one medical consultation to the next. You lurch from one test result. You hang off it. There's a degree of anxiety when that blood is taken, and it stays there until you get the okay. You have no control in illness at this point in time. Having a positive attitude if you've got cancer can help. This prospective study on patients with lung cancer showed that those that had optimistic personalities lasted about 6 months longer. Not cured, just having some optimism, having a positive slant on it does help. So I do think there is an alternate metabolic model of cancer. I think our current treatment is based on the chromosomal abnormality that targets cell duplication. It does work for a lot of people, but the treatment of chemotherapy and radiotherapy is toxic to us. Our current treatment still encourages unrestricted sugar and carbohydrate consumption, and I am driven particularly insane by cancer fundraising with cakes and morning teas and pink icing. I think the future of treatment has to focus on starving cancer. And I think it is about incorporating, or at least considering, nutritional ketosis. And my understanding of it is that nutritional ketosis is bad for cancer and it's protective of the cells around it. So what about low-carb healthy fat? Well, it's actually safe for all ages. I think it will improve the effectiveness of radiotherapy and chemotherapy, and that's certainly been shown in small studies. I think ketones are in fact protective to the cells surrounding a cancer. Does it give the patient some control? Yes. Does it give some hope? Yes. And if it's good enough for treatment, then shouldn't we apply it to prevention? It's the cheapest treatment of all. So does the genetic model hold up? Well, I don't think so. There is another way to look at cancer based on energy and building more cells. The Warburg effect on glucose metabolism explain the PET scan, and the other materials and metastasis are potentially explained by that reverse Warburg effect. The metabolic model gives us a whole new concept to treatment options with multiple sites of intervention. Let's make the environment unhealthy for cancer to grow. And starving cancer is critical of that. Nutritional ketosis starves the cancer of the glucose and protects the tissue around it, and it certainly takes away the insulin and insulin growth factor 1 stimulation. If you give it a toxic environment, it's hard for cancer to grow. It's not guaranteed to stop it, but I think it's a good start. Now, I do have a declaration of personal interest. I was raised on processed food. I was a fat kid. And 15 years ago, in 2000, I began my journey with cancer. You start developing a vested interest in this topic when you hear the words, "you have cancer." Those words will strip you of hope. They will suck the air out of your lungs. There is a complete sense of helplessness for you and your family. I had surgery twice. I had radiotherapy and chemotherapy, and I was shattered, and so was my family. My PET scan was positive. I had never heard of the term nutritional ketosis. I had no concept of missing a meal, let alone fasting. Processed food, I think, was most likely feeding my cancer, was probably contributing in retrospect. I then decided to starve it of glucose. I decided to starve it of insulin and insulin growth factor 1. My weight's come down. I am still here. I have hope. I have a vested interest. So I think we did go the wrong way. I think the microscope distracted us for 90 years. I do think chromosomal damage is a marker of cancer and just not to blame. It's just there at the scene of the crime. So I challenge you, and I challenge the medical profession, to actually consider that the primary problem of cancer is glucose metabolism. And this opens up a whole new range of options in managing cancer. And it certainly has for me. So it means adding in nutrition to cancer, not taking away other treatments, it's adding it in. I think nutritional ketosis has a role to play for those that choose it. You don't have to do any of this. It's what you want to do. It's not about replacing traditional treatments. It's about making surgery, chemotherapy and radiotherapy more effective by sensitising the cancer and then protecting the cells around it. Where to now with this whole topic we've been discussing today? And we've just scratched the surface of it. Is there a role for low carbohydrate, healthy fat living? Is there a role for LCHF? Well, I think so. Otherwise, I wouldn't be doing this. Start researching it for yourself if you haven't already. That's what I did, and that's why I'm here now.